Let's talk about the molecular basis of cancer. There are certain group of genes which help in preventing cancer. At the same time, there are certain group of genes which help in the occurrence of the cancer. So it's always the dynamic equilibrium between these two groups of the genes, whether a person will be getting cancer or not. So now let's talk about the genes which help in the process of oncogenesis. The first group of genes, we call it as tumor suppressor genes. The name itself says that these prevent the occurrence of the malignancies. So you need to remember the names of the genes. So tumor suppressor genes, the most common, you have three genes. The most commonly involved tumor suppressor gene is P53, also called as TP53 genes, which is located on the chromosome 17 short arm. The next one is RB gene, also called as a retinoblastoma gene, which is located on chromosome 13 long arm. And next one is APC gene, adenomatous polyposis coli gene. So these are the three most important tumor suppressor genes. The next group of genes, we call it as proto-oncogenes. So these proto-oncogenes will modify into oncogenes, and these help in the oncogenesis. So these are harmful to us, and so these genes will be causing cancers. So just need to remember a few names of these. The most commonly involved proto-oncogene is RAS. And next you have MIC, MIC, and you have KIT, and you have RET. So these are the four proto-oncogenes which are involved in oncogenesis. Now coming to the third group of genes, which we already know are about those genes involved in the apoptosis. As you all know, apoptosis is programmed cell death. There are certain genes called proapoptotic genes which increase the apoptosis, so the cell number will decrease. So these stop in the progression of the oncogenesis. So let's see what are these proapoptotic genes. So proapoptotic genes are nothing but BH3 group of genes, those BIM, BID, BAD, BAK and BAX. And coming to the anti-apoptotic genes. So these anti-apoptotic genes stop the occurrence of the apoptosis, so the cell number increases. Thereby these genes help in the process of oncogenesis. So these are Bcl-2, MCL1 and Bcl-X. So these are the anti-apoptotic genes. The other group of genes are the DNA repair genes. The name itself says if there is any damage to the DNA, these genes will be repairing those damages. So these are obviously good for us. So if there is any defect in the DNA repair mechanism, there will be oncogenesis. So these DNA repair gene defects causing oncogenesis, the best example is xeroderma pigmentosa, you have Ataxia, telangiectasia, and you have Bloom syndrome. So these are the DNA repair gene defects. And the two most important things in oncogenesis are, the first one is telomere. So as you all know, telomere is the terminal part of the chromosome which helps in prevention of the stickiness of the chromosome to the other things. As you all know, the age advances, the telomere length will become shortened. But there are certain conditions where the telomere length is maintained because of the uncontrolled activity of the enzyme telomerase, thereby causing malignancies. And next one is angiogenesis. So for every tumor it needs some blood supply. So the occurrence of these growth factors which help in oncogenesis obviously will add more in the oncogenesis. So these angiogenetic factors are nothing but vascular endothelial growth factor and fibroblast derived growth factor. So to summarize,